Acute pancreatitis 2. Pancreatitis is an inflammatory process in which pancreatic enzymes autodigest the gland. The gland sometimes heals without any impairment of function or any morphologic changes. This process is known as acute pancreatitis. Worldwide, the incidence of acute pancreatitis ranges between 5 and 80 per 100,000 population, with the highest incidence recorded in the United States and Finland. Long-standing alcohol consumption and biliary stone disease cause most cases of acute pancreatitis. Other common causes include post-endoscopic retrograde cholangiopancreatography, abdominal injury, certain drugs. Rarely, acute pancreatitis may be caused by infection, hereditary factors, hypercalcemia, hypertriglyceridemia, pancreatic tumors, developmental pancreatic disorders, toxins, surgeries, and autoimmune pancreatitis. Abdominal pain is the cardinal symptom of acute pancreatitis. The pain is dull, boring, and steady, usually sudden in onset and gradually becoming more severe until reaching a constant ache, most often located in the upper abdomen and may radiate directly through to the back. Other symptoms include nausea and vomiting and diarrhea. The patient with acute pancreatitis may have the history of the following: recent operative or other invasive procedures, family history of hypertriglyceridemia, previous biliary colic and binge alcohol consumption. The variety of physical findings may be noted, varying with the severity of the disease. Rarely, acute pancreatitis may become severe necrotizing pancreatitis, which are characterized by features like Cullen sign, Gray Turner sign, erythematous skin nodules. Once acute pancreatitis is suspected, certain laboratory tests are obtained to support the clinical impression. Diagnostic imaging is usually not necessary in most cases. It may be recommended when the diagnosis is in doubt, when pancreatitis is severe, when a given test might provide specific information required. Acute pancreatitis is broadly classified as either mild or severe. According to the Atlanta classification, severe acute pancreatitis is characterized by evidence of organ failure, few local complications, Ranson score of 3 or higher or Apache score of 8 or higher. For managing mild acute pancreatitis, the patient is kept NPO, and 4 fluids are provided. Analgesics are given for pain relief. Antibiotics are generally not indicated. Antibiotics, usually of the imipenem class, should be used in any case of pancreatitis complicated by infected pancreatic necrosis but should not be given routinely for fever, especially early in the presentation. Antibiotic prophylaxis in severe pancreatitis is not currently recommended. Surgical intervention, whether open or minimally invasive, is indicated only when an anatomic complication amenable to a mechanical solution is present. The overall mortality in patients with acute pancreatitis is 10% to 15%. Patients with biliary pancreatitis have a higher mortality than patients with alcoholic pancreatitis. Type 2 diabetes mellitus is associated with higher severity and mortality in acute pancreatitis. In patients with severe disease, who account for about 20% of presentations, mortality is approximately 30%. In the first week of illness, most deaths result from multi-organ system failure. In subsequent weeks, infection plays a more significant role.